to be here.
Hi, Zainab. Welcome.
Yes, thank you so much.
Very, very happy to have you here.
Thank you. Good to have
Yeah.
you too.
Yay.
So, welcome everybody. Good morning or good afternoon, wherever you are. We have people based in Africa. We have people based in Europe here. We have people based in South Latin and North America. So, welcome to you all. My name is Meria Arizmendi. I'm the Community Building and Engagement Coordinator in Catalyst now. And today I'm so honored and privileged to welcome you into the Love, Romance, and Family Planning Beyond Babies by Dr. Farah Mahrukh Shroff and Jasman Sekhon. So this is a conversation cafe that we have been planning for so long. Dr. Farah and her team are so amazing and they're so inspiring because one of the things that they did, they tried to understand what was family planning about right now and how could we go back to some simple things, just as the constitution of a family, the constitution of a marriage, a partner, finding somebody you love, and also including family planning in love dimensions. For all that know me, you know that I usually choose a song that resonates with the topic. For now, we had Foreigner, I Want to Know What Love Is. And the sole reason why I thought of this song is because the message that Farah and Jasmine are bringing to us today, it's that love is so much more. So this is an invitation they are giving us to think and rethink about love in different dimensions, especially in a dimension that has to do with family planning. So I welcome all of you today. Let me also introduce some cafe suggestions. So if you can, please include your name, your country, and your organization in the chat. It's always wonderful to see who's connected, where are you connecting from, and know a little bit more about the work that you're doing. If possible, of course, keep your camera on. So in this, I want to be super, super honest. If you're having internet issues, if you're having internet interferences, that we know, we face a lot of that in the global south. So we always prioritize the content, the knowledge, the sharing. So if internet is not working so well for you, please keep your camera off. But if you can make the effort of having your camera on, it's always so much better to see each other's faces, to see each other's reactions. We're already creating connections through that simple thing that's seeing each other. Then we have amazing hosts today, but please remember this is an interactive session. So please do feel free to share any questions, any comments, any insights, anything that you'd like to share in the chat, or let us know if you want to share something with Dr. Farah. And last but not least, celebration is key. We know we're living in a world where time is of the essence, where time is the most valuable thing, and we struggle with finding time. So I really want to say thank you to all of you for making the time to join us today. It's really awesome to be in the same room and with such an amazing topic ahead of us. So without further ado, Farah, I'm going to stop sharing so you can share your slides. Welcome, everybody. It's amazing to see you all. And let's enjoy this moment.
Oh, awesome, awesome, awesome. Well, welcome to everybody. Can you see my slides easily?
Yes, we're not seeing them in presentation mode.
Okay, just one
yet.
sec. Okay. Oops. That's not the mode I wanted. There we go. How's that?
Excellent.
That good? Okay, my friends. So here we are talking about what love is. I'm sure we have lots of answers for that. And I'm so happy that you're telling us where you're from. I was born in Kenya, so I'm super happy that there are people from Kenya, Tanzania, Nigeria, where I've lived. Oh my goodness, what a joy. All of you from everywhere, you're most welcome. I am gonna Yes, just tell you a little bit about our agenda today. We're going to talk a little bit about this organization called Health Together. It's a global public health organization. Of course, we're going to talk about family planning and love, and we're going to talk very specifically about a specific type of family planning called symptothermal methods. And then we have an invitation for all of you so that today, hopefully, will not be the last day that we are connected. We have an invitation for you to connect with us on this course that we're designing, and we'd love you to take us up on that invitation. So I am here on the lands of the Coast Salish Nations, and I would like to acknowledge very much the stewardship of the Musqueam Nation. Now, before I move on, I just want to say that today is a very, very special day for people in the community that I belong to. I was about to tell you a little bit about myself, but I'll leave that for a moment. I'm a Parsi, which means that our community originally comes from Persia, and we've been in South Asia for about 1,000 years. So like, I know I look really young for being 1,000 years, but our community has been in South Asia for about 1,000 years, and our ancient heritage is for today. Today is called Char Shambe Suri. So I just wanted to tell you a little bit about what today means for all of us. So Char Shambe Suri is a day where we get ready for the new year. Our new year is happening on Thursday, which is the beginning of spring. And as we get ready for the beginning of spring, what we do is we shed the things we don't want and we ask for the things that we want. And we do that by jumping over fire. So I just want to ask all of you if you can think to yourselves, so, what is it that you would like to get rid of? Here's what we say to the fire as we're jumping over it. If you speak Farsi, you'll understand this. Zardi man as tu, sohriye tu as man. So you're saying to the fire, hey, fire, can you take all the yellow and faded stuff that I don't need? And can you give me all the red and the good stuff that I really, really want? And so, what I'd like to ask you to do is to just think, what is it that you would like to get rid of for the year? And just think about that and just imagine that the fire is burning it up. And then in the chat, put all the things that you would like, either for yourself or the world, for this new year that's coming. And I'm going to tell you one of mine, the good things that I want. I would really like peace and justice and no more trade wars. Like, we live in a country right now, we're having a trade war. So I would like that to be left behind. And I'm really hoping that we have a very peace and just society. So why don't you pop a few things into the chat for the things that you're hoping for the new year? And you can unmute if you would like and tell me. And welcome to Jasman from Brazil. I know you have some good things that you would like to bring in for the new year, Jasman. Okay, let's see. Okay, let's see what hoping for good health. Oh, yes, may all of you have good health. I wish that for all of you. More human connection and empathy, love and caring about one another. Oh, absolutely. More love in the world, my friends. And Zainab, you said, I want the fire to burn sadness and anxiety and give me red happiness and peace. Oh, I wish that so much for you, Zainab. Yes, that's so beautiful. And oh, and Bridget, this year I want to know what love is. Oh, so perfect with the theme of our song. Oh, yeah. I wish that for you, that you know what love is, Bridget. And Ramakrishnan Prasad said, for next year, love and joy, gratitude and peace for me and the world. Oh, yes, 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 Ramakrishna Prasad. Thank you. These are so beautiful. Is there anybody else who would like to share things that they would like, the red things? Let's hear. We have Amanda, more equitable resources for mothers, babies, and their families. Oh, yes, for all the mummies, babies, and families, more equitable resources. I think I've spent a huge amount of my life wanting that too. So thank you. Yes. Okay. We'll do one last one here from Alpha. And it says, oh, sorry. It's Alpha says gratitude and compassion. Yes, yes, yes. Okay. Last one from Davidson. I want the fire to burn the spirit of rejection, yes, and usher me into favor and acceptance, yes, to be included and cared for and understood. I hear that. Thank you, Davidson. Oh, this is so beautiful. Okay, so in the spirit of Charshambe Suri, I wish you all a beautiful Charshambe Suri Mubarak, and may the springtime bring us more green things and more life and more beauty, and may this new year be a beautiful new year for all of you. All right, so let's get back to these slides. Okay. Here we go. So we said thank you to the Musqueam Nation. All right, so I told you a teeny bit here, a little bit about me. I was born in Kenya. I think Davidson is from Kenya. We also have some Tanzanians here. My parents are from India and Pakistan. Our ancestors are from the Middle East. I'm a Parsi. I am the founder of Health Together, which is a global public health collaborative. I am based here in Canada, but in 2021, I lived in Boston for a year because I was selected for this fellowship at the Harvard School of Public Health. And now I work at Harvard as a health lab board member. I'm called an expert at the Harvard Innovation Lab. I'm also the founder of this social venture, which we're going to be talking about today, called Stretchy Fertility Planning for All Couples. And I love yoga. I have been doing yoga since I was about 3 years old. I I've taught yoga now in about 60 countries around the world. I also meditate. That's a practice that's something I do every day. I dance. I teach a dance, which is the dances of my own bones, a little bit of African dance, a little bit of South Asian dance, and a little bit of Middle Eastern dance. I call it world dance. I love to write poetry, and the thing that I really live off of is a diet of Persian poetry. And I'll just quote very, very quickly for you. A little Rumi. Rumi said, "You are not the ocean in a drop. You are a drop in the ocean. You are a drop in the ocean, or you are an ocean in the drop. Either way, it works." Okay, so here we go. I wish you Chashambe Mubarak. And I just want to check. So who all is in this room? Let me just stop the slide for a second here. Can you all tell me a little bit about who you are? I just wanted to know, like, hands up, who would consider themselves a clinician, like a physician, midwife, anybody who serves patients in any way? I know Ramakrishna Prasad, yeah. Who's the midwife? Stephanie, right? Yeah, please use your Zoom hands or your real hands, whatever you like. Yeah, thank you. Yeah, okay. Who considers themselves a researcher? Researcher? I don't know why my hand went up. Okay. Who considers themselves someone who knows something about fertility and contraception? Okay. And oh, welcome to all the new people who are coming. Who considers themselves somebody who is passionate about making the world healthier? Ah, oh yeah, I know we got a lot of us in the room today. Okay, awesome. Uh, who is a student? Are any of you a student? Okay, awesome. All right, well, that is great. So I got a sense of who you are. All right. Students, parents. Oh, I forgot to ask parents. Who here is a parent? Parents? Okay. Okay, perfect. I'm definitely a mummy. Okay, perfect. I know Jerson is a parent. Yes. Yeah. And a grandparent. And Lisa as well. I know quite a few of your parents. Okay, here we go. All right. Um so the presentation today is being hosted by Catalyst, and the organization I founded is called Public Health Together. We used to be called Maternal and Infant Health Canada, and we are likely the world's only global public health organization that boosts systems of traditional health. We are all about supporting those who identify as women, young ones, and the environment to have the best health possible in here in Turtle Island as well as in the global south. And we recognize that in most countries around the world, excuse me, most countries around the world, that systems of traditional medicine are actually those which serve the vast majority of people. So our organization is here to do that support through supporting systems like Ayurveda, traditional Chinese medicine, yoga, meditation, indigenous systems of medicine, and so forth. We have lots of events that we would love you to come to. Lots of them are online. We hold webinars very regularly. They're free, and we only have 6 a year. And we'd love you to email that email or look on our Facebook. We've got our social media team lead here who can put that into the chat. Isabella, maybe you can pop these things into the chat so people can know about us and keep in touch with us and come to our next webinar, which we'll have in a couple of months. Okay, so now I want to tell you a little story because this is all about love and romance. So I want to tell you a little story about my Indian parents, just to get us onto the topic. So as I told you, I'm a Parsi. My parents were both born in India. India separated during my parents' lifetime, and so that's why I said my dad was from Pakistan, but he was actually born in India. So, so in our culture, it's not very common for women to get married really young. But my mom actually got married at 17. And so what ended up happening was she moved from India to Kenya to take care of an auntie who had this really big operation and needed some help. And my dad ended up in Kenya because he didn't want to practice law in Pakistan when after separation. It just didn't work out very well. So these two Parsis ended up in this place totally far from home, and they met each other, and they ended up getting married. And so my mom's only 17 when she gets married. By the time she's very full and pregnant, she's 19, all of 19. She's basically still a teenager. She's very, very full and pregnant, jumping up and down for joy, very, very happy she's pregnant. And the truth is, when somebody asked her, so my mom's name was Rani. So Rani, how did you get pregnant? And she actually did not know. She didn't know what made her pregnant. So this, I just came back from a tour in India, doing a lot of talks around India. This unfortunately is not entirely uncommon, even in India today. So how come my mom didn't know she was pregnant? Because she had never had any sex education. She always knew she wanted to be a mommy. She loved being pregnant, and she was thrilled to be pregnant, but she really had no clue how she got there. And so the topic today is really about talking about contraception and sexuality, and people really like my mom. My dad, I have to tell you, so my mom was only like 19 when I was born. He was about 12 or 13 years older than her, so he absolutely did know how they got pregnant. So there was a little bit of a difference in who knew what in their relationship. Yeah. Okay. Did anybody say anything here? Yeah. Mary asked us how come. Yeah. So anyway, so that might not happen in some parts of the world, but in some parts of South Asia today, there is still a huge lack of knowledge about the body. You do not talk about sex, and even if you're having it, which my parents obviously were. Okay. So here we go. Back to the slides. So this is the kind of hat, it's called a dugli, that the Parsis wear. My mom was wearing a sari at her wedding. My dad was wearing a dugli. That's a little image of what they would have looked like. Okay, so now, given that people really don't know a lot about sexuality, birth control, and contraception, it's not too much of a surprise, although I have to say for most of us, this is a surprise, that in 2023, the latest year for which we have really solid global data, that about 48% of pregnancies, so that's about half of global pregnancies, were unintended. So that actually adds up to a huge number in the millions here, which I've got there. That's a lot of pregnancies, a lot of babies which weren't necessarily planned for in the world. So what is going on here, my friends? How is it that we have, on the one hand, we have the pill, the IUD, condoms, injectables, we have all of these forms of contraception, and somehow we're still coming to this place where we're having about half of our pregnancies which are unintended. Just have a little think about that, please. Okay, here's a little opportunity for you to tell me what you think. So the question for you is, birth control is a woman's responsibility. Just pop your hand up if you agree with that. Hand, Zoom hand. Oh, perfect. Yeah, here's the poll. Do you believe that birth control is a woman's responsibility? Okay, here we go. We're seeing our results. We've got 3 options for you to answer. Give us your answer, my friends. Some of you are not so sure how you feel about this. Some of you agree. Okay, let's just give it a moment here. All right. Is that enough time, my friends? Everybody's had a chance. Let's just see. We've had we've had about 2/3 of you respond. I think that's good enough. Okay. So it seems like few of you do agree that it is a woman's responsibility. A majority of you say it's not a woman's responsibility. And then there's a few of you who aren't sure. So we'll share those results for you to see. Okay, so uh, in the world today, the reality is that birth control largely is considered a woman's responsibility. And the vast majority of birth control methods are women's responsibilities. If we think about the pill, that's something that the woman has to take. She has to take it pretty much every day and at the same time every day. And she has to be very, very consistent. In fact, she has to be fastidious if she wants the contraceptive pill to work well. Then there's the IUD. Again, that's inserted into the woman's uterus, 100% a woman's responsibility. There's the female condom, or the internal condom, as it's sometimes called. That's also a woman's responsibility. And then there is the condom, which is really one of the only forms of non-permanent birth control, which is not the female's responsibility. So so for those of you who said you don't agree that it should be the woman's responsibility, why don't you just pop into the chat why you don't think it should be a woman's responsibility? I would love to know why you think that it shouldn't be just the woman's responsibility. Any thoughts? And if you feel like unmuting, just unmute yourself and tell us what thoughts you have there. Anybody?
I don't even know I don't know where to begin, Farah, on why I don't think it's the woman's responsibility. I could go on for a long time. Why should it be her responsibility is where I would start. My daughter just graduated from McGill, and her professor has actually developed a very successful, safe male contraceptive that there's no take up on because there's no market. So it's not going to, even though he spent all this time developing it and it works and it's safe, no one will take it on to market it. I mean, I don't understand. So why should it be, particularly when it's quite easy to put on a condom, as opposed to all of the other options, which are either invasive or involve a pharmaceutical. So I don't know. That's it in a nutshell. Makes no sense to me. The baby is both the parents. I don't know why one parent bears that role. Makes 0 sense to me. Is that enough?
I think that's awesome, Lisa. You are getting us rolling. Thank you very, very much. Beautifully said, Lisa. And then, oh, and here's Ramakrishnan Prasad, I think, agreeing exactly with you, Lisa. You're saying, other than self-pleasure, sex involves more than the woman alone. So why should the pleasure not be shared? Right. Why should the pleasure be shared and the risk borne only by the woman? Oh, so beautifully said. Oh my goodness. We are really rocking here with an amazing, amazing sentiment from those of you who are here. Okay. Well, so we've got our poll. So most of the people here agree that birth control should be a shared responsibility for the very elegant reasons that we have heard from you here. Thank you. All right. Okay, so we've done our Zoom poll. So let's just talk a little bit about what happens. We're talking about something now that largely around the world is considered to be one out of the two partners, right? We're talking about heterosexual relationships right now. Let's just talk about what happens when there is a pregnancy that wasn't planned. This is really a pretty horrific and traumatic experience for a lot of people. I'm guessing, if you just want to put your hand up, if you can tell me, do all of you know somebody who's been in this situation where they've had an unintended pregnancy? Just by show of hands, have you ever met somebody who's had this situation? So I can tell you, one of my oldest friends had this situation, and she was mortified, petrified, and terrified. It was the worst moment of her life. She wasn't ready to have a baby, and she couldn't tell anybody because it's such a stigmatized situation. So I can tell you in my own experience what it was like to be supporting a friend who was really, really caught in this situation. There's a financial stress, relationship stress. Sometimes unintended pregnancies cause breakups. Sometimes they cause violence in the relationship. And sometimes they even cause death. So it's a pretty big deal. Unintended pregnancy is not a light subject. We've not picked a light subject for our Trashambe Suri presentation. I've worked for many, many years in this field of global maternal mortality, and we know that still today in 2025, even though so many of us, many of you in the room have worked to prevent this, that there are still about 800 women dying every day of preventable causes related to pregnancy and childbirth. The really other tragedy here is that mothers in the lowest social and economic brackets have about 2.5 times higher mortality rates. And what we know here, if any of you, I'm just asking, have you ever met somebody who's lost their mother in childbirth or at another time? If you haven't, then let me just explain that when somebody loses their mother, they lose their best advocate. Mothers are children's best advocate. They are the ones who will stand up for their child no matter what happens. Mom is gone. That child struggles in school. They struggle in their emotional life. They struggle with relationships. Mom is there to buoy up and support kids no matter what is happening. And when mom is not there, life becomes pretty hard for that child. Okay, so what we know is that unintended pregnancies often stem from poverty, from these very, very steep social and economic hierarchies, and then all of the lack of talking about sex, talking about what love really means, and how we can really share love between men and women, and really, of course, between all between women and women, men and men, between transgendered people, non-binary people, between everybody. There's just such a stigma in most parts of the world that we don't talk about these things. And so when unintended pregnancy happens, people don't feel free to talk about it. And so we have really profound social and individual consequences, which really affect millions of people on this planet. Okay, we're going to go into breakout rooms now, and Mari is going to help us with that. And we're going to just ask you all to think now, and be very creative. There are no right answers here, my friends. Just allow yourselves to feel very, very kind of liberated in your ways of thinking about this. How could we change the reality of unintended pregnancies? What systems need to be in place to prevent unintended pregnancies? So Mari's going to pop you into some breakout rooms, and we're going to give you not a long time. So just about 5 or 6 minutes here. Just chat amongst yourselves, and then we'll come back. Okay. So please go right ahead. You'll get the message to get your room and go for it.
Perfect. Thank you, Farah. I'm going to open the rooms. It's 4 people in each room. And let me know if you need any support. You should be receiving either a pop-up or either go directly to the room. Bridget, do you need any support? Oh, perfect. So far, I think we're still missing a few groups that are coming back.
Okay, we'll get them. We'll get them back. Okay, welcome back, friends. So happy you're back. We'd love to hear from any of you, either written in the chat or if you just want to quickly unmute, like what solutions did you come up with? What were some of the thoughts that you shared? I was in a breakout room where we had some brilliant ideas. So I'd love for you to just share some creative thoughts on how we're going to work through these issues as a global. Go ahead. Who would like to say something or put something in the chat?
I'll say something. I don't have, because I'm not really good at putting things in the chat.
Yeah.
2 people spoke in our breakout room, very interesting. They weren't solutions, but they were just kind of, state of the world statements in their current community. And so I will just say that. I think on a very basic level, if we're going to have unintended pregnancies, and it not to be a disaster, there has to be better systems in place to support that new little family. And that I can only speak from the North American experience, that doesn't exist. So then there's just a huge scramble if someone is pregnant and not planned and doesn't have a great family network, doesn't have resources. I mean, I don't know what people expect are going to happen in that situation. It's not going to be good. So that's, so that's not what to do about having the unintended pregnancy. There's a whole other discussion there. I'm talking about, well, baby's going to be born. So now what? And there's not enough in place if you don't have money. That is the bottom line, right?
Yeah. So, in the field of public health, the field that I work in, we talk a lot about how societies that put a lot of emphasis from the years 0 to 6 are the healthiest societies. The year 0 means when a woman is pregnant. So how can we as societies support pregnancies to be healthy? How can we bring the village around that family? How can we make sure that families have enough money, have enough housing, have enough food, all of those things, education, and then once the baby's born, providing education and literacy, library programs, stuff like that. Like we know that societies that do that really do much better in almost all of their public health measures. So yeah, and I'm just going to quickly see, is that anybody else want to contribute? And if not, I am going to move.
Coming
Oh, please go ahead. Yeah.
in a sense of this issue, in other communities, government and can assist NGO to come in terms of relief outcomes when this kind of cases happens, in terms of education, in terms of relieve them on how to go about it and where to go and how to do about it. It starts from the beginning to the end of the pregnancy. So that as a financial aspect, when the government cooperate with the NGOs and stuff, that's part of the role that the government can also play based on the communities where the individual comes from.
Yeah, thank you, Dr. Andy. So happy to have you here from Nigeria. And absolutely, yes, to have cooperation of both non-governmental organizations as well as governmental organizations to really provide as much support for families in the pregnancy phase as well as at least up to age 6 years. We know that makes a huge difference. That's one of the reasons I founded a non-governmental organization, because I know that we have lots to offer. All right, so thank you very much for all your participation. All right, so let's just talk a little bit about what's going on here. What choices do exist? We've already talked a little bit about this, the pill, IUDs, condoms, and more. So here are some of them, little pictures. We've got cervical caps, diaphragm. Lisa, we don't have that method that you talked about. We got to get that on our slides. The male pill, thank you. We got to fix that on here. Yes, we got to get the male pill on here, and we got to help. We'll help to push that now that you've told us about it.
Yeah, I don't know if it was an injection or a pill, but I can ask Ava what that was.
Yeah,
Interesting.
you get back to me, okay, Lisa?
Okay, I will.
Yeah, thank you. I definitely want to know more. Okay, spermicides, vaginal rings, emergency contraceptive pills, implants, contraceptive patches. There's a lot of stuff out there, and I'm sure most of you have heard of those. So now let's just talk about the side effects, because that's where this conversation is just about to take a turn onto, is the side effects of these forms of contraception. So we know from the literature, we know that that clinically, that for IUDs, people do get infections. They do work. Remember, IUDs are like 98% effective. They do work at preventing pregnancies. They don't work for STI prevention. They don't work at all. There's no barrier for sexually transmitted infections. We know that the pill or oral contraceptives work extremely well for what they're supposed to do, which is prevent pregnancy, but they also have side effects, and that one of those can be not for all patients, and this is not, again, an indictment of these forms of birth control, but that they do have side effects. And one of the ones from the pill is cardiovascular disease. Condoms, I'd say condoms have probably the least side effects because they're pretty safe. The only thing is that people often don't use them correctly, that they let them get into the heat, or they don't press the tip of the condom and roll it down the penis properly. Those are the real risk with the condom. Otherwise, condoms, in the view of people who really work in the area of birth control like I do, we consider condoms to be very, very safe. Hormonal contraception, as we know from the pill, headaches, mood swings, weight gain, that's a huge one, especially for younger women who get really, really concerned that they're gaining a lot of weight. And the mood swings are more than swings. It can be actually depression. And then Depo-Provera, which is an injectable often used in the global south, not one that I am a huge fan of, because it has a big concentration right at the beginning, and then it sort of peters out. It's supposed to be lasting for several months. And so, yeah, a lot of us who care about side effects are not a big fan of Depo-Provera and the other injectables at all. Yeah, so I'm actually doing a clinical trial. Well, we are, as an organization, Health Together, on osteoporosis, which is a disease of low bone density, and Depo-Provera actually can decrease bone density. So again, those of us who care about women's health and care about people being as healthy as possible are not a fan of these of those injectables for sure. Okay, so I'm just going to ask you, I'm going to just stop. I'm going to ask you, what is the most natural form of birth control? Are there any forms of birth control that have no side effects? Just want to ask you all that. Let's just, you can just pop it in the chat. Or Mary, are you thinking to do an actual poll? Yeah, okay, so Mary's going to do that poll.
No, actually, that's why I put like chat discussion.
Okay,
So, because
yeah.
the poll doesn't really allow members to write their thoughts. So the chat is a way better to do that.
Yeah, let's do it. I know at least one of you doesn't like using the chat. So if you want to unmute and say anything, please go ahead. And I'm as well, we're waiting for people to put stuff in the chat. So what is, okay, rhythm. Okay, thanks, Bridget. Yeah, the rhythm, has no side effects. Right? Okay. Anybody else?
I mean, I guess there's a charting your menstrual and like charting when you're most fertile. I don't really know how it works, but I've heard of it.
Okay, that was a perfect segue, Lisa.
Okay.
I promise everybody, Lisa was not a plant. We did not ask Lisa to say what she just said. Okay, condoms. Yeah, thanks, Stephanie. Or symptothermal method, but still need to use. Yeah, okay. Spoken by a true midwife. Thank you, Stephanie. Yes, absolutely. Okay, so both Lisa and Stephanie were not here as plants. The calendar method. Yeah, the calendar method, but one may miss dates, issues of STDs matters. Yeah, thank you, Alpha. Okay, you are totally rocking it, my friends. All right, so that absolutely leads me to the next part of our presentation. So yes, are there any forms of effective contraception without side effects? Yes, there are. And let's just get to it. So, because here I am as somebody who works in the field of natural health, in the field of public health, and in the field of women's health primarily, it really seems to me that something new is required to prevent unplanned pregnancies, maternal deaths, to promote more equality between men and women, to reduce the side effects of current fertility methods, and also for those of us who care about the environment, it's always important to look at methods that can be more green. So what could that possibly be? Well, since we've had plants here, here is our solution. This is nothing new. We did not invent this. It was Bantu people from the eastern part of the African continent. I always have to say that, being born in Kenya, I'm always so proud of these things. Bantu people who invented this technique, as well as indigenous people. We know that Cherokee Nation grandmothers taught their daughters and grandchildren how to do this. So it's not brand new. It's quite an ancient form of fertility tracking, and it has been tested scientifically in the modern era. Basically, this is a natural family planning technique which tracks a fertility cycle, and it works both to avoid a pregnancy as well as to get pregnant. So it works for both things, and it's totally side effect free. So here it is. So if we start over on the left top corner, symptothermal methods, safe and free from side effects, pretty easy to learn. It's basically a science course when you learn it. It's highly effective. I published a paper on this, which we will have up on the screen, which shows that it's about as effective as the pill and the IUD and the condom, all of the non-permanent forms of birth control. It's up there, between about 96 and 98% effective in perfect use, right? Like those are the quotes for all of those in perfect use. It's a very low cost and very accessible material. It's basically just a thermometer that's required. And again, it can be used once you learn it. It can be used as birth control, and it can also be used for fertility. It is suitable for everyone. So that means whatever your religious background, whatever. The really cool thing, really cool, is that the Catholic Church completely approves of this technique. So I have taught this technique when I was in Guatemala, when I was working in a midwifery collective there, and the Catholic Church is totally good with it. In fact, the Catholic Church actually teaches this technique themselves. I've also taught this technique in the Middle East because Islam also approves of it. So that's a very big bonus from my perspective as somebody who works globally. Yeah, really it is. And the last thing here is that it empowers couples with knowledge about their bodies. So, again, as somebody who loves yoga and meditation, and I really feel very passionate that people have the right to know about their bodies. What's happening in your body? How does your body work? That kind of knowledge is truly power. And I really want more people to have that kind of knowledge. So you might know, so I heard a few things when we just did our Zoom poll. You might know STM as the Billings method. That's what it's called in the Catholic Church. You might know it as fertility awareness-based methods. You might have heard of it being called a natural family planning, but STM is not rhythm. Rhythm definitely doesn't work, and I'll quickly explain to you. So if you look at the diagram here, the fertile window there, we see the menstrual cycle, where you see the menstrual phase, the follicular phase, and ovulation, and then the luteal phase, which comes after that. Basically, this cycle, this little circle we've got here is 28 days. That's what we use as the kind of sort of baseline average. But the vast majority of women don't fit averages typically. So one woman's cycle might be 28 days, but another's might be 26 days, and another one might be 31 days. And so the problem with the rhythm method is that it just assumes that the cycle is 28 days, which is essentially just wrong for the vast majority of women. It's not 28 days for everybody. You need to know how many days that cycle is in order to know when ovulation happens. And as you see in the diagram there, ovulation happens, the most fertile days there's, about 72 hours, maybe, on either end of that, a few days. So we always say about a week or so is a highly fertile period. But that's why it's super important not to mix up STM with rhythm, or I guess it's also kinder, which is also this assumption of the 28-day cycle, just kind of like on average, just incorrect. Yeah. So the three key techniques that STM uses is cervical mucus. The most important method is cervical mucus. So on the right-hand side, you see a picture here of the uterus, and you see the cervix, which is what we often call the neck of the uterus. And from the cervix drips a kind of a mucus or a fluid. And it drips pretty much every day as long as a woman is between menarche and menopause. After menopause, it doesn't drip, and before menarche, it doesn't happen. So it's just in that reproductive time of a woman's cycle, there's going to be mucus coming from the cervix. And that cervical mucus has different textures. So on the diagram here, you see with the fingers, you'll see that on the bottom right-hand corner of that diagram where it says cervical mucus, you'll see that the fingers are spread like this. The picture could even be better, because typically in that ovulation phase, that time of ovulation, the mucus is very, very stretchy, which is why we have called our social venture Stretchy, because it's all about finding this time of ovulation. So this spin barket mucus, it's very clear. It looks a little bit like egg white. And for most women, it's really it's pretty stretchy. You can stretch it between your fingers and you will see it's pretty stretchy. That's the ovulatory mucus. After that, in the post-ovulation time, the mucus becomes kind of thicker and tackier. And if you look at that mucus under a microscope, it usually looks like this. It's more like a grid. Whereas the spin barket mucus, you can see how it would help. If you just look at that diagram, there's the vagina there. It would help sperm go up the vaginal canal and into the uterus and beyond. And the post-ovulatory mucus is actually going to stop it. So we have Mother Nature creates this kind of incredible scientific way to help people to get pregnant and to avoid pregnancy. And you just have to be able to know how this works. So in concert with the mucus is the os. The os in Latin means hole. And so the cervix, if you look at it like, from a straight on, and just imagine that there's, during the fertile part, it's a wider open, a much more moist opening. Just at the time when the spin barket mucus is really, really stretchy, the hole is open. It's sort of this perfectly well-designed system for helping people to get pregnant. The body, again, I personally just think the body is amazing. And then there's also temperature shifts that happen at that time, but not with a regular thermometer. You need to have a basal body thermometer. Okay, so that's the basic technique. Here is the part of the body we're talking about. Okay, so you're going to say, don't sell this stuff to me. There's got to be a catch here, right? So what is it? So we know that STM is effective. It's eco-friendly. It's evidence-based. It provides shared responsibilities in a heterosexual couple between men and women. But unless STM is done with a condom, it's not going to protect against STIs. And I guess the other catch is that it's not like taking a pill every day, or it's not like just getting somebody to do something for you or to you. you as the couple have to actually be pretty involved in this. You have to learn it, and it takes time. We'll tell you a little bit about the course that we're designing. We're planning that it will take a minimum of 4 months, but probably about 6 months of learning, about an hour a week. So that's the only catch, but no other catch there. All right, so we have a few resources here. If you want to take a picture of the screen, the bottom one is the paper that I wrote. It's called "What is the Symptothermal Method? Offering Patients an Alternative Birth Control." The link is there. There's actually lots of good information online. This is just a few of them. Yeah, around the world, there are people who are really trying to promote this, but the truth is, the vast majority of people on planet Earth have never heard of symptothermal methods and don't really know what it is at all, don't know the science behind it. So that's why just the awareness of it is an important thing. So Health Together, which is the public health collaborative that I founded, and that Isabella, who's here, and Jazz, who's also here, and who's going to take over the last part of the presentation, are a member of. We started a social venture because we wanted to be part of the solution for this huge issue of pregnancy. And so we've started the social venture, which basically I told you already, it's called Stretchy, based on that spin market mucus, fertility planning for all couples. And what are we doing? We are basically teaching people how to do STM. It's basically an online course, physician designed by PhDs and physicians, one doctor of traditional Chinese medicine. We've got real experts who work in the area of fertility, designing it, making it all online, so it can be done by people from all around the world, and mainly asynchronous, like not at the same time, so that you can do it at your own time. We're going to try to make it really mobile friendly, so things can be done also on your phone. But basically, the main part of this technique is identifying ovulation, figuring out that time when you can become pregnant, that stretchy spin market mucus at the same time as the cervical os is a little bit more open and moist. So we didn't know, in a country like ours, whether or not this would be something that people were really interested in. So Isabella, who's here, as well as quite a few other members of our organization. I think we have a group of about 10 people doing interviews of basically people between the ages of 15 and 25, and maybe up to the ages of 45. We've had them doing interviews, asking people, tell us about your sexual practices, what kinds of birth control do you already use, and what are you interested in using? And this really surprises me. Remember, we've only interviewed maybe about 60 people. So we're not talking about a large data set here, right? This is just, us talking to people, asking them all the same questions. And this is surprising to me. I have to say, I wouldn't have thought that this would be true in Canada. But what we're learning is that, maybe about a third of the people we've interviewed are happy with the birth control they're using. But then about 2/3 of them are not really very happy with it because they don't like the side effects mainly. What we're seeing again here is that, because of course we're really interested in people doing things that are promoting gender equity, promoting planetary responsibility, promoting communication between men and women, things that are natural things, right? So that is my agenda. I have that as an agenda. I want the world to be a better place, a fairer place, a greener place. So here we are, that people, we're finding, this is again kind of surprising to me, that there are even people in North America, quite a few, willing to try Stretchy. We don't know what this will look like with the majority of the population. Again, we've got a small sample here, but this is what we're learning. What we do know from the literature is, and so this is Canadian data, that about half of the women using hormonal contraceptives, and I have to tell you, the vast majority of people in North America use the pill. That is the #1 form of contraceptive in North America. They report adverse effects. And because of these, and so we talked about those earlier, mood swings could be as serious as depression, up to suicidal ideation, like pretty serious stuff, weight gain, and then up to and including other more serious conditions. So more than a quarter of the women in this study published in the Canadian Medical Association Journal actually stopped using it and then had unprotected sex. So now we're getting a sense of why we have in Canada, in a country where we have, although it's costly, we've now made birth control free all over the country, why we have these problems. So it's not, cost isn't the only factor here. People are genuinely concerned about side effects. All right, so let me tell you a little bit about a couple who we interviewed. These are real people, but their names are not the same. So Jean and Joe are two of the people we interviewed. They are in their 20s. They've finished both of them have an undergraduate degree. They really, really like taking care of their health. They're really into weightlifting, and they both love going to the gym as a couple together. They've both got good jobs in their fields. And here are direct quotes from Jean and Joe. Joe said she's tried the pill and experienced depression and suicidal feelings. She gained 15 pounds in 2 months. And then Jean said when she tried the IUD, because the pill wasn't very good, my cervix rejected the IUD, and although the pain is gone, the trauma isn't. Because what happened, she told us that the physician tried really, really hard to insert the IUD, and it was very painful and very difficult. Her cervix and her uterus just wasn't taking the IUD. That does happen to some people, not the majority of people, but we happen to have found somebody who told us that. And so what they both told us is that they feel really left behind, like the system doesn't care about us. We want another option. And again, this is happening here in Canada. I'm not talking about somewhere else. We're talking right here, the country I live. So this is the sort of reality of what people have. If we just look, and this is pretty much a global kind of reality, the choices that people have. Let's just look along at there's the pill, the IUD, condoms, and then there's also some tracking apps, not like Flow, Glow, Clear. There's quite a few of them that do tracking. So if we look at the things that matter, so does this work? Is it effective? Does it have side effects? How much does it cost? Is it reliable? Like, can you use it, long term? Is it freely accessible? Does it protect you from STIs? And is it green? Like, these are the things that I think matter the most. If you just look at this table, you'll see that the pill, high efficacy, still has some side effects. It's kind of costly. It is reliable. It's not free, except for maybe Canada and other countries. It's becoming free. It doesn't protect you from STIs, and it's not very green. And similarly, if you look at all of the things around the world, it's really hard to find something that checks all the boxes. So we think that by doing STM, symptothermal methods, with a condom, that we are checking pretty much all of the boxes. We're getting there anyways. We're trying to get to that. Oh, oopsie, Isabella, are you able to, I'm going to stop my share. Are you able to quickly show our video?
Yes, I can do that and pass it right back to you.
Okay, let's do it. Here we go.
Can you see my screen there?
You betcha.
Awesome.
Okay, so this is a video that we made. I can't hear
think
the audio.
Isabella, you should share. So when you go to sharing and there's a pop-up at the right part, it says options and you have to tick share sound.
Okay, sorry about this, friends.
Don't worry, it happens all the time.
But we would love to share. It's just a 1-minute video. We'd love to share it with you. The hand drawings were done by one of our members, Harleen. So we're pretty happy with it. Oh, is
Oh,
it gonna?
okay. Maybe, Isabella, do you have a
Isabella?
link that I could share?
Yes, I'll share the link in the chat.
Okay,
The link is on the
I'll tell you what.
slideshow. I'm not
While
sure
we're
when
doing
it's happening.
while we're
Sorry
doing
about
that, should I just move on? And then Mary, you can share it in a moment. Yeah. Okay. Perfect. Thank you so much. So while Mari is figuring out that and helping us out with the video, I'm just going to keep going for a bit, and then Mari, you just tell us when you're ready. Okay. So what we're trying to do here, again, we're a global public health organization. We care about health for all. And what we really want to do is provide simple, comprehensive, and engaging education. We want to make people like have fun learning about their body. We want basically the science of fertility to be known by as many people as possible. Eventually, here's my real hope. And here's a wish for Charshambe Suri, that everybody knows about their bodies and really understands the science of their bodies. That's eventually what we want to do. We want to get this course into high schools and into universities so that people understand how all of this works. Most people don't know that cervical mucus is this incredibly high fidelity scientific gauge of fertility. Like cervical mucus is a very powerful thing to know about. So that is one of the things that we want. So learning how to do all of these things is what we're really trying to do. Okay, here's our team. So it's really not just me. I'm up here doing all the talking, but we actually have way more people on our team that are on the screen. We've got Dr. Nargis Gorgi, Amanat Gill, Sarah Kelly, Jasleen Sahota, Jasman Sekhon. Jazz is here with us today. We have Dr. Nadar Chawla. We have a much bigger team that's even on this screen. Okay, so before we do the video, I just want to say,
Okay.
that we are doing this course. And as I said at the beginning, my invitation to you is to pilot test this course, to get in touch with us. Here's the email, and Isabel also put it in the chat, and she can do that again. If you write to mycancares@gmail.com, we invite all of you. What we really want though is couples. So as long as you're in a couple, in a stable relationship, and you want to learn this technique, or if you know people, we want people from all over the world. The only thing we need, again, this couple in a stable relationship and good internet connection, and prepared to be really committed to doing 6 months of learning. We need people to help us to pilot test it. We're just getting the first draft of the course done. And then once the pilot test is done, then we're going to launch it even bigger. But we need to work out the first few kinks. So yeah, please do get in touch with us. We'd absolutely love to have you do that with us. Okay, so Mary, why don't you share the video? And welcome to anybody who just joined
Sure.
us. Thank you, Mary. And I am going to be shortly passing the baton to Jazz in a few moments after the video. He's going to take the rest of the presentation. Okay. The technology piece is often the thing that does it to us. Okay, Bridget is saying, are we looking for couples who don't or do want to? Either. Absolutely. You could be a couple who is wanting to get pregnant or not wanting to get pregnant, whatever your stage is. It's a very practical course, and it's just about teaching people the technique. That's all it is. So it's very practical. This is how you gauge the mucus. This is how you do the temperature. This is how you look at the cervical os. And it really does involve both male and female. So that's why we want couples to take it. Yeah. Mari, are we able to do the video, or should we leave it for today? It seems like it's becoming a bit of a bugaboo.
I'm so sorry about that. Let me share again.
Yeah, no problem. No problem. If we can't see it, it's okay.
No, but it was my internet.
Oh, okay, that's what it was. Okay.
Yeah, something happened. It kicked me out
Okay.
of Zoom, in fact.
This is the
Go
reality of
again.
technology.
Yeah,
It helped them
I'll
to
start
have.
again.
Nate and Noor are a couple celebrating their 1-year anniversary with a romantic evening.
They later discover they had an unintended pregnancy, which applies to about half of Canadian pregnancies. Nate and Noor then searched for a reliable fertility method that had no side effects, would enhance their communication, and be green.
Enter Stretchy, a 6-month online course that takes only an hour a week. Through expert training, Noor and Nate learned to gauge cervical mucus and os changes while charting basal body temperature. This gave them freedom to enjoy intimacy without side effects, and in a few years, it helped them to have a baby.
We plan to market this relatively unknown form of fertility planning to those who are inclined towards natural health, yoga, and nutritious food. It's approved by various religious groups, so it suits a wide diversity of couples.
Stretchy is a fertility solution that will profoundly transform the lives of couples here in North America and soon the world. Thank you. Thank you, everybody. I am going to pass the floor now to Jazz to do the rest. We're pretty much done actually, but I'm going to let Jazz do the rest of the presentation. So please go ahead, Jazz.
Thank you, Dr. Shroff. We just have a couple slides left. We're almost towards the end. But next we'll actually be going into breakout rooms again. Mary, if you can help us out here. And the question is, we want to discuss and share our views about simple thermal methods. And have you ever heard about it before? And what are your thoughts? So we can discuss this in breakout rooms.
Excellent. Jazz, could you let me know how many minutes do we want to give?
I just want to confirm, are we looking to end around 9:30?
Yes.
Yeah, I think we're almost towards the end, so maybe like 5 to 7 minutes, anywhere in between
Okay.
the
Super. Okay. Davidson and Subi, let me know. Perfect.
I think that everyone is back.
Yeah, Jazz, the floor is yours.
Thank you, everyone. I hope everyone did have a great discussion. I do know we're trying to finish by 9:30, so I'll just quickly move on and then we can have discussion afterwards as well. Sorry, give me 1 second here. Can everyone see the screen all right?
Perfect.
So what are our plans with Health Together in the future? So the first is to pilot test STM course for couples starting fall 2025. So we do hope that we can have a lot of participants within the pilot test course and start it sometime in the near future. Hopefully start maybe in the next few months, we are able to start that pilot test course. And then once that is done and we are able to get feedback and move further along, we also would like to design a course for high school and university students as well. We think that's important as well. So in the future, after the pilot test course, and then moving further on, I think we are also looking to create a certification course for healthcare providers. And this can be used by naturopathic doctors, MDs, even midwives, and many other professionals. And the reason for this is so that they can also teach it to their patients or people that they're dealing with as well. So this way it's as accessible as possible, and we are able to spread the message about STM. And our course is being designed by physicians and public health experts as well. And we have a lot of different input in making the course. So just to summarize what we have been going over is that unintended pregnancies can lead to silent struggles that many couples do face globally. Stretchy is an online education platform to empower couples in their family planning journey. And we do invite you all to pilot test our course. And if you have any questions at all, please do reach out to our email, mycancares@gmail.com. I do believe it is in the chat as well. And if you have any questions at all, about anything that we went over or about the pilot course, please do feel free to send an email. I just want to say thank you to everyone for taking the time out and being here with us and listening to our amazing presentation. So I do really, really appreciate that and everyone's time. Thank you all.
Thank you, Farah. Thank you, Jess. And thank you, Isabella, for also supporting. Thank you all for being here. So we'll be also sending the information afterwards. And just for your knowledge, all this session will be posted on our official Catalyst Now YouTube channel. So as Jazz and Farah were saying, like, this is a couple thing. So if you thought about any couples you'd want to share these insights with, you'd want to put them in contact with this amazing organization, please feel free to do so. So thank you so very much and see you next time. Bye-bye.
Bye, everyone. Thank you.